Elbow problems are a very common problem that we see in our practice. Tennis elbow and golfer's elbow are very common injuries that require treatment. In our practice and in our lifestyles that we have here in South Florida, people don't want to be held down. So the repetitive gripping that we see in tennis, the repetitive gripping that we see in people who work with their hands, in laborers, and the repetitive trauma of the golf swing leads to people having tendonitis problems in their elbow. If the tendonitis occurs on the outer aspect of the elbow, we call it lateral epicondylitis or tennis elbow. If it occurs on the inner side of the elbow, we call it medial epicondylitis or golfer's elbow. Generally, these are treated non-operatively. Rarely do they need surgery. Usually, we treat it through they're treated through an extensive self-directed rehab program, and sometimes we have to use cortisone injections to help the patient get through their real acute phase. There's also advances that have been going on that have minimized the need for surgery if all else fails. We've recently been using platelet-rich plasma injections. These can be done in our office with no incision. We take a patient's blood, we spin it down, we extract the healing tissue, the healing potential within the blood, the platelets, and we re-inject it into the injured area of the patient, and we allow those platelet cells to heal the tissue. So this is an exciting advancement that we've been using more and more, and it definitely has decreased the need for surgery.